Heart valve replacement. Introduction.
Which of the following is a function of the heart valves? 1. To allow the blood to flow through the heart smoothly. 2. To prevent blood from leaking back against the main flow. 3. Both. Correct. Stenosis and insufficiency put extra strain on the heart. Select true or false. Correct. With stenosis, the heart has to work much harder at pushing the blood through. With insufficiency, the heart is less efficient at pumping blood to the body. Over time, this can cause a lot of strain on the heart and could even lead to death. Patients with a mechanical valve have to take blood thinners for the rest of their lives. Select true or false. Correct. Do tissue valves last a lifetime? Select yes or no.
Correct. Even though recent techniques are allowing tissue valves to last longer, these valves do wear off and may need to be replaced every 10 to 15 years.
During the procedure, is blood flow in the body totally stopped? Select yes or no.
Correct. Though the heart is stopped, a heart-lung bypass machine keeps the blood circulating and full of oxygen. This maintains a needed, constant supply of blood to the body. Are strokes and other bypass-related complications common during and after this operation? Select yes or no. Correct. Anesthesia and bypass are safe, but the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist or surgeon aware of any medical problems you have had in the past, such as strokes and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. In rare cases, they can cause death. The symptoms may include swelling of the leg, shortness of breath, and chest pain, but rarely a blood clot can go to the lungs and cause death without giving any other symptom. Are infections common after surgery? Select yes or no. Correct. Infections are rare. Though rare, infections as well as bleeding and scarring may happen.
Is the operation always successful? Select yes or no.
Correct. The valve replacement may rarely fail. The replaced valve could malfunction during the surgery, shortly or long after the surgery. In spite of the surgeon's best effort, the heart may not restart. Death is unlikely but possible.
Is it impossible to injure the blood vessels along the path of the catheters inside the body? Select yes or no.
Correct. Even though this is rare, an injury to the blood vessels inside the body can lead to internal bleeding and possible strokes and may require immediate surgery to save the patient's life. It is important to remember that these complications are very rare. Thank you for using Explain.